Thank you, Mr. Chairman, and thank you for holding this hearing today. I'm sorry I didn't get to sit through the majority of it. I had another committee that I had to chair, so I couldn't leave. But it's probably just as well because I've only been here for about 20 minutes, and I think my blood pressure has increased probably 100 points in that period of time. To begin with, let me clarify something that my colleague, Mr. Grothman, asked about. One of the witnesses about how much a price of a drug goes toward the pharmaceutical manufacturer and how much goes to the PBM. I'd like to submit for the record a report by the Berkeley Research Group that shows that 37%, only 37% of the price of a drug goes to the pharmaceutical manufacturer, which begs the question, where does the other 63% go?
Without objection to order.
Thank you. Secondly, we talked about, again, my colleague asked about spread pricing and what can be done about it. Actually, I have a bill up tomorrow in full committee with the Energy and Commerce Committee that will prohibit spread pricing in Medicaid, and that will help us tremendously. Hopefully, we can expand that later on into the commercial market, but right now we can get it through Medicaid, and that'll be something that'll help us. Dr. Atkins, you mentioned white bagging. I was down at MD Anderson in Houston probably a couple of months ago, and they were just up in arms about the white bagging and how they were having to deal with that and what a problem it was for them. And they're being forced to do it by the PBMs, and it is just something that is an obstacle to care, and they can't, in good conscience, they don't know that this is a valid prescription or a valid drug and that it's formulated correctly. They have to do it in-house in order to be able to do that. So white bagging, as you point out, is a serious, serious problem. The other thing, since I've been here, again, I'm certainly glad I wasn't here the whole time. Lord, I'd never get through. But you talked about the IRA and about the prescription provisions that were in the IRA and how good they are. I think they're awful. I think they're the worst thing that has ever been done in the way of prescription drug pricing. The CBO, which of course is nonpartisan and looks at the economic results of legislation. The CBO estimated that as a result of the prescription provisions that are in the IRA, that we can expect anywhere from 15 to 20 fewer cures in the next 30 years as a result of that. 15 to 20, and that's not from me. That's from the CBO. Now, I would ask you, which of the 15 or 20 cures is that going to be? Is it going to be the cure for cancer? Is it going to be the cure for Alzheimer? Which one is it going to be? So I just have to disagree respectfully that the prescription provision in IRA is something good. Now, I will tell you, wow, it flies when you only have 5 minutes. But I will tell you, as you know, and Dr. Dwayne, I want to ask you this because I practiced pharmacy for over 40 years. I started when I was 10 years old. That explains that. But I practiced for over 40 years. I was the one, like you, who had to tell the patient how much the medication cost, who had to watch the senior citizen make a decision between whether they were going to buy the medicine or whether they were going to pay for groceries. I was the one who watched the mother cry when she couldn't afford the antibiotic for her child. Now, you have naval bases within your area.
Yes, sir.
And recently Express Scripts through TRICARE has limited participation in that program. Has that impacted you and your pharmacy?
Yes, sir, it has by quite a lot. We were dropped from the TRICARE network along with 10,000+ other pharmacies. And yes, we have Naval Station Mayport and we have Naval Air Station Jacksonville, and it has been a big impact. We have patients who really want to come with us, to continue to come with us in the TRICARE program. We can't do it. Now, of course, some of them can. They choose to pay out of pocket, and they still come to my pharmacy because they appreciate the level of service that we give, but they pay out of their own pocket, and they can't use their TRICARE benefit.
And these are our heroes. These are our veterans and their families who have served our country, and they're being told by a PBM that they cannot get medications from what I suspect they've been getting it for years from you, generations. Yes. I had the same thing happen to me, literally patients in tears. I've only got just a few seconds left. Dr. Atkins, I have to ask you because I don't think there's any, all of this is egregious, but it is especially egregious in the oncology world, especially with the specialty pharmacies and where and you'll see this chart behind me. I meant to mention this as well. This shows you the vertical integration. You see how busy it is? That's what the vertical integration is. But Dr. Atkins, you've seen it. You've seen where the PBMs are directing your patients to go to their specialty pharmacy to get the medication, which, as you know, and Dr. Dwayne, you know as well, oftentimes they just throw up their arms and they just don't get it. Any comment, Dr. Atkins?
That's correct. If I give the patient a medication in my office, I know they walked out the door with the drug. If I wait for it to be mailed to them, I don't know if they got the medication. I don't know if the medication's safe. I don't know how long it's sat on their porch. There are a lot of moving factors going on. It's just not safe for patients.
Absolutely, and it's all about the patient. Look, I'm not opposed to anybody making money. It's a capitalist society. I get it and understand that, but I'm telling you, PBMs bring no value whatsoever to the healthcare system. No value. At least pharmaceutical manufacturers put money back into research and development. PBMs don't do that. This is highway robbery. They are, as the Attorney General of Ohio has said, they are gangsters. We need to stop them. And I can't thank you enough, Mr. Chairman, for having this hearing and for bringing this to light. And I yield back.